I would say almost all of them.
The vast majority of chronic degenerative diseases begin with problems in the mouth, infections and toxins, and it's only until those are addressed that you're going to get any clear positive response with your disease.
Well, root canal procedure is still a very, very popular thing in dentistry because no one wants to lose a tooth. But more and more people are beginning to realize, even from the current day modern and very traditional literature, that it's impossible to sterilize a root canal system.
Most conventional dentists believe there's no problem with them, but I personally couldn't disagree more. I think that they're a hidden source of toxicity for almost anyone.
To help keep the infection in check.
70 to 90% of all medical problems actually originate in the mouth. Conventional dentistry still has a focus on the mechanistic Newtonian mentality, that the teeth are not connected to the rest of the body. I mean, embryologically, the teeth develop from the same tissues that gives rise to your sympathetic and the parasympathetic nervous system. The blood supply and the mouth literally will take any toxins via the lymphatic system and take it down to the thyroid, the thymus, the heart, and the rest of the body. So there is a direct connection.
The teeth is not just like a stone in the mouth. It is extremely densely connected. The pulp is extremely densely connected to the lymph system, to the autonomic nerve system. More than any other organs, it's connected to the afferences, the sensitive nerves to the brain directly, and to all meridian systems.
Every tooth connects up energetically through the meridian system to certain organs and glands. So for example, on the upper side of the jaw, the last two molars and this bicuspid actually connect up energetically to the left breast, and on this side it's to the right breast. And 95% of the time, women who have breast cancer who undergo a thermographic study will be found to have hot spots in the jaw on the same side as that malignant breast.
97% of our breast cancer patients in an age between 30 and 70, we tested all these patients, they had a root canal or a toxic situation in the teeth.
The discussion of the energetic relationship of the teeth to the rest of the body is very interesting. Every tooth lies on a specific acupuncture meridian, relates to certain organs and tissues and vertebrae and muscle groups. And so very often you can see a direct relationship. For instance, there was a 19-year-old girl, her first year in college. She had a root canal on a front tooth.
I use a piece of equipment that was originally called EAV, electroacupuncture according to Vol. I put electricity into the body, and then you gather data from that. So when I'm testing teeth, I actually have the person holding a bar in their hand, and that bar is the collection point, and they touch a tooth and put it in the circuitry, and then I introduce, by touching on a particular acupuncture point, I introduce the electricity into the body to see if it can go all the way through that meridian. And you start seeing where electricity is being blocked, and now you start asking questions about the person's health, and they go, wow, how did you know that? I didn't even tell you that I was having problems there. Because when the electricity can't get through, it compromises that meridian.
Many people have trouble getting their mind around the fact that their teeth are making them sick. But let me just tell you that a year or so ago,